Can you not control your anxiety and you've been to the doctor and they can't really give you a solid diagnosis? There's lots of other reasons why you could be experiencing anxiety. Watch this. Dr. B here with our series on demystifying the DSM. And they were actually going to record me saying this is a really big book. And it can be, intimidating. All of these special diagnoses and the, special codes under those. I'm a generalist, and I want people to see the big picture in balance. And so that's how I'm presenting this. We're in anxiety disorders, and we are going to talk about kind of either, medically induced anxiety or substance induced anxiety. The reality is a lot of times we do treat things the same, even if it's a medically induced anxiety, we'd still use the same antidepressant type treatment, and obviously treating the medical cause at the same time. Substance abuse, and we'll have a whole series on substance abuse, but if you think about substance induced anxiety, this is actually super common in the substance abuse population. So let's take alcohol, for example. Obviously, this is the most abused substance. And, caffeine's probably the most abused, but we're not going to go there because that's me too. You can have anxiety from too much caffeine. What happens with alcohol is a CNS depressant. So it decreases neurotransmission, and it decreases kind of the whole central nervous system. So what happens is when you're withdrawing from alcohol is when the anxiety is pretty severe. And so this is important when someone is trying to stop drinking, is that they understand that this process is going to happen. And I often have people who drink, who I have identified as substance abusers of alcohol, that when they're like, well, I can go a day without drinking. I can go a whole 2 days without drinking. But the reality is that anxiety actually peaks at 72 hours, which is 3 days. And oftentimes that is one of the questions that I'll ask to see if this is really an addictive process, this anxiety when they're not drinking. Obviously, stimulant type medications can cause, stimulant type substance use can cause anxiety, right? Meth, cocaine, anything that's going to increase. Psychedelics can cause anxiety from the fear of the disassociation that can be occurring. So, there's clear understandings there. And the treatment is we've got to get you off of these substances that are causing the anxiety. But coming off of them, like I explained with alcohol, can be very difficult. The actual anxiety that occurs when you're trying to stop, and even long-term, the anxiety that alcohol was actually treating for you. So we talk a lot about sometimes people are using substances to self-medicate, right? If you have generalized anxiety all the time and you can't calm down without a drink, let's talk about, you also have generalized anxiety. Let's treat that generalized anxiety, which that's another video, while we come off this substance that's contributing to the problem. So substance use always complicates the diagnosis. Is it truly just substance-induced anxiety? Or is it generalized anxiety or some other kind of PTSD that we are masking or trying to treat ourselves with the substance? And there's no way to know until we get rid of the substance to see what is the underlying. There are a lot of mental health clinics that will tell you, we won't treat you until you're sober. And I understand where those providers are coming from, because it's a very difficult population as far as, the choice to get off of substances. But here at Mentally Strong, we will help you treat your anxiety with non-controlled addictive substances to try to treat the underlying condition so that you can stop using your substance that's kind of contributing and causing the problem. So I encourage you to find a provider that will do that for you, but also respect that there are boundaries if you have a substance use problem that is, contributing to your anxiety. We are going to always be trying to get you off that substance, okay? Because we have to do what's best for you. So substance-induced anxiety, you've got to come off the substance that's causing it. If you got to the end of the video, you obviously enjoyed some of the content. I have a lot of free content out there. I am really trying to empower everyone to find their mental strength. So subscribe, get the actual notifications, and let's embrace this journey of mental strength. See you there.